Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
In collaboration with Boise State Public Radio, the Community Library presents a new podcast, Sheep Stories. I'm host Vance Cunningham. Join me as we listen through the archives of the Trailing of the Sheep Festival to learn about the Scottish, Basque, and Peruvian immigrants foundational to the sheep herding industry over the past century. Hear their stories of traveling to Idaho and learning the language of the sheep. Find Sheep Stories wherever you get your podcasts and at boisestatepublicradio.org.
From the studios of Boise State Public Radio News, I'm Gemma Gaudette. You're listening to Idaho Matters. As some politicians in our country pushed the message of personal choice on vaccinations, doctors and infectious disease experts are sounding the alarm. They are warning that this isn't just about one person's decision. They say getting vaccinated protects you and it protects an entire community. However, the debate continues as the head of Our Nation's Health, Robert F. Kennedy Jr., continues to pull back recommendations for things like the COVID booster, saying it hasn't been studied enough to be effective. Dr. David Pate, the former CEO of St. Luke's Health System and the co-author of the book, Preparing for the Next Global Outbreak, is joining us today to talk more about all of this. Hi, Dr. Pate.
Hi, Gemma.
And folks, if you do have a public health question, send us an email, idahomatters@boisestate.edu. Okay, Dr. Pate, I want to begin today by talking about a belief or maybe a message that I've been hearing more and more lately. So I'm assuming maybe you have too. And that's the idea that why should you care what I do with my body or my child's body when it comes to vaccines? Because if you're vaccinated, you shouldn't care if anybody else is. What concerns do you have with that belief system?
Right. Well, I have heard that. And the problem is that assumes that everyone can get vaccinated, and it assumes that vaccines are 100% protective. Neither one of those is true. So if I had a young grandchild, it's very possible that there's going to be a period of time until my grandchild can be vaccinated or can finish the first full series of the vaccine. If my child is in daycare or elementary school, then that grandchild may not be fully protected. The other thing is that the other reason that we do this is because it protects everyone. And that because there are people that have changes in their life circumstances. They could develop cancer. They might need to go on chemotherapy. They might develop an autoimmune disease or a rheumatic disorder that they need steroids or some other medicine that compromises their immune system. There are children and adults with primary immunodeficiencies, meaning that they acquired a problem with how their immune system works, so that even if they get the vaccine, it's not fully protective. Certainly, we've talked before about, now that I'm in the old folks category, that our immune responses do get weaker with time. And so there's all these reasons why we do this, because we want to protect everybody. And for example, we've talked about with the measles vaccine, even though that is highly, highly effective, when you have an outbreak, you will have a small percentage of kids that were vaccinated that will still get infected, as we've seen. They just don't get severe disease.
Dr. Pate, there is something else that I have literally seen some social media influencers talking about in the space within the MAHA movement and folks who might take issue with vaccines, and that is that why should I get my child vaccinated for a disease that I've never heard about? I don't know what diphtheria is. I don't know what the mumps are, right? And so there's this idea that, well, if I've not heard about it, then I don't need to worry about it. Again,
Right.
can you
Yeah.
talk about this? Because I think it goes back to this idea that, well, that's because vaccines did their job.
Well, that's right. And so I have not even seen all of these diseases, but I've seen many of them. I've seen polio. It's dreadful. It can be. I've seen um, cases of Haemophilus influenza B or HIV infection, which is terrible when it's invasive. And so, I've, but even a doctor my age may not have seen all of these, but that doesn't mean it's not out there. And in fact, it is. And if we let our guard down, then we will see these diseases. And unfortunately, that parent that is questioning themselves, and I understand why they're questioning themselves, but let me tell you, you don't want your child to be the child that dies of tetanus. That is a dreadful way to die. You do not want your child to be the child that dies of diphtheria, which is another terrible way to die. Um, and the reason we know it's out there is we do see very small numbers of cases of these among people that aren't immunized, and especially when they go to other countries where they still deal with some of these diseases as outbreaks. There are places in the world where polio is a concern. There are places in the world where some of these other infections are of concern. And you might travel to those countries, or somebody from that country might travel here.
Mhm. And we should note too that the mumps can leave boys sterile. I mean, that is a side effect of the mumps.
Absolutely, and so people don't know about these things. A number of these viral infections that you haven't seen, rubella, measles, so forth, they can leave children deaf or leave children blind. And so, yes, it may not be real common, but why do you want to roll the dice with your own child?
Mhm. So, Dr. Pate, with that, I wonder though if part of that is because we do know that vaccines are not 100% effective, right? So I think there's this idea that, well, they're not 100% effective, so therefore, not only are they not effective, they're not safe. And why do we need right? We just need herd immunity. That's what we need is herd immunity. Eh, Again,
Right.
there's just
Well,
misinformation out there, right? So can you kind of again explain about herd immunity? Because we should note that the state of Idaho has the lowest vaccination rate in the country. As of last school year, we were sitting at about, I think, 79.2% immunity. That is not enough immunity for herd immunity.
Well, and there are some viruses that you're not going to get herd immunity to. Now, a great example for herd immunity is measles. And that's why we know if we have sufficient vaccine levels, we will have herd immunity. What herd immunity means is in the answer to your first question, when I mentioned some of those people, like a very young child or maybe an adult going through chemotherapy, uh, 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 those individuals who either can't get vaccinated or won't benefit from the vaccine. What herd immunity means is if enough of the rest of us get vaccinated, then they're going to be safe because that virus won't be circulating and infect those people in all likelihood. So it gives them protection because the rest of us can be protected. So that's the herd immunity thing. But not all viruses give you herd immunity. We don't get herd immunity from the influenza virus. We don't get herd immunity, regardless of what our FDA director said. about COVID and the SARS-CoV-2 virus. And there's reasons why. I've written a whole chapter about it in my book that people
Hmm.
can read about, but it doesn't work for everything.
I heard an analogy about vaccines the other day that I'd like to share with you and get your thoughts on because I think for folks who might not fully understand about vaccines and how they work. I thought it was just a really kind of a more simple and descriptive way for people to understand it. And it was this. It said, when you as an individual get a vaccine, you're not putting on a coat of armor to protect yourself. You're helping to build a dam that won't break. And every single person who is vaccinated is a brick in that dam. In your opinion, is that a good analogy?
Oh, it is. That's a very good analogy. And it shows how it speaks to the fact that we personally benefit, but also we help protect others. So, from the personal benefit standpoint, a lot of people are under the misconception that, I'm going to have better immunity if I'm naturally infected. And that is just not correct in most cases. And so, what vaccines do two things. They help give our immune system a head start so that when we are exposed to an infectious agent, that either it might prevent us from getting infected, or at least it gives us enough of our head start that we can prevent getting severely ill. The other way that it protects us is that oftentimes why people get as sick as they do when they're exposed to something that is brand new is because the immune system can overreact. And so, what getting the vaccination does is it actually moderates that immune response, it tames it so that you've got the head start so you don't get as deathly ill, but it also tells your immune system, hey, we got this, we've seen it, we've got a good handle on it, and we don't have to release nuclear bombs. And
Mhm.
because that's when we saw, particularly in kids, them developing MISC, where they were deathly ill after they'd gotten exposed. And we see that in older people when they would get COVID, and a lot of times when they would get very, very ill the second week, is a lot of that was the immune system was overreacting and trying to get the virus under control.
I want to turn now to the Senate hearing that happened last Thursday, and RFK Jr. was grilled from a Senate committee, and they, of course, talked about vaccines, about the COVID vaccine. I'd like you to clarify a point that RFK Jr. made during the Senate hearing, and this was in particular about COVID boosters. So, and I believe I could get this wrong. I think it was Senator Bill Cassidy from Louisiana, who is also a pediatrician, and he was questioning him about why did you change the recommendation on the COVID booster, because you're essentially keeping vaccines away from people. And RFK Jr.'s reply was, "You want me to recommend a vaccine that has not had FDA trials? Like, I will not do that." This is the point I want you to clarify, is that he is correct in that boosters don't go through the same type of trials that a vaccine goes through. But the flu shot is in this category because it is a booster. The COVID vaccine is a booster every year. I can you explain this, because I am not a doctor, and I have read about this, and I think I have an understanding of why the booster doesn't go through as many, trials. So could you clarify that?
Yeah. So all of the brand new vaccines that we have not had before, unlike what RFK Jr. and some others have said, they have all gone through placebo-controlled trials. They before they were approved. So that happens with the original shot. Now, like you were mentioning, influenza. Influenza virus is it swaps whole segments of its genetic makeup with other influenza viruses, so that every year we can see very different influenza viruses. And we don't have a whole lot of time for trials, but if we have an existing vaccine that platform has already been tested in these initial trials, in placebo-controlled trials, we know they're effective, we know they're safe, but now we just need to tweak the antigens, not the actual platform for the vaccine. It's not something, a brand new type of vaccine. We reached agreement decades ago that that does not need a new trial. We're just not going to be able to keep up with this virus. And in fact, but we monitor the new vaccines every year, and we look for safety issues as it gets. Frankly, you're vaccinating many more people than you would in a trial anyway, and we've seen that it's very, very safe. And the same thing for the COVID vaccines. The FDA took the same approach when that vaccine substantially changed. Then there were some trials to look repeatedly at efficacy, but we don't have to go back to the drawing board and check safety and all if we have not modified the very foundation of the vaccine, if it's not a brand new type of vaccine. Now, each of these different COVID vaccines, they've all been through those trials. And so what RFK Jr. is saying is, first of all, that's not our scientific approach. Second, we have a lot of data about their safety. And because this vaccine has been given to hundreds of millions of people, which is far more than we usually give of many of the other more well known vaccines.
Dr. Pate, we have a lot of listener questions, so let's start with Alice. She writes, could you ask Dr. Pate to report on the rising COVID numbers and the status throughout the fall and winter, including wastewater results? We're in our mid 70s. We've never contracted COVID. And then they say thanks in large part to Dr. Pate's advice. So, can we get those numbers? Do we even have them, Dr. Pate?
We have some, and Alice, you've made my day, so thank you, and good work to you and your husband. The answer to your question is that if we look at wastewater data, which is the most consistently available data, because so many states are not reporting actual cases, but some states are, and you can certainly look at those. Like I think New York and Washington still report those. You can look at those if you like. But the wastewater shows high levels of SARS-CoV-2 virus in the wastewater across the country. There are some areas that are even higher in a very high level. That includes Idaho, but also California, Nevada, Texas, Alabama, Illinois, Florida, and both of the Carolinas. So, and then the test positivity rate is currently reported at 10.8%. And if you remember, anything over about 5% means we've got significant community spread.
Mm. Alice has had another question as well, Dr. Pate, and she writes, due to the national confusion over CDC's chaos and COVID vaccine timing and availability, will this mean that many people will not get updated vaccinations, and therefore will our risk for exposure be higher?
That is my fear. And I think that there's so much confusion. There's confusion among doctors, among pharmacists, among the public. And I've already been hearing some people are having no problem at all. And so that's great. Other people are having a challenge getting the vaccine. I'm hopeful that will get better over the next couple of weeks. But on the other hand, I'm bracing myself for the next meeting of the Advisory Committee on Immunization Practices in just over a week, which is going to now be an entire committee of nonsense. So who knows what's going to happen then? But yes, that is a concern.
Barbara wrote in and she says, where can we get trusted, accurate information about flu and COVID cases? Who will have this data for the public and healthcare providers to keep us informed and protected?
Well, first of all, thank you, Barb. Obviously, Jim and I will try to do our part for you because I look at quite a few different sites so that I make sure that I'm getting a reliable and complete picture. But certainly, the National Wastewater Surveillance System (NWSS) that is a good site, and the wastewater scan site. Those are good wastewater, and they present data in a little bit different way, so you can get some um, different insights. The COVID tracker is one way to get some of the test positivity numbers, like I was talking about. For influenza, I look at some different sites. I look at probably my favorite is FluView, but also because I don't think you would be interested, but because I'm trying to advise people, it's very helpful for me to understand what's going on in the Southern Hemisphere because they have their influenza first, and then that gives me a good idea of what to expect up here. So I look at the World Health Organization influenza surveillance system and look at that, but it will also follow when we're in our flu season as well.
So Jimmy wrote in and he says, could you please have a quick COVID update each week? He said it would be useful to know what the current risk level is here in Idaho, as well as surrounding states, regardless if the level is high or low. He said, I would like an update on the version of the current vaccine and availability. It's hard to know if other information sources like drugstores, et cetera, are accurate and pertinent to Idaho. I believe that COVID remains a significant risk for many people. So Dr. Pate, I guess that's up to me and you if we want to do a COVID update every week. But also, do you even, as you gave Barb all of those places that you looked just a moment ago, is there a way to get a weekly update? I guess.
Yes, I can still get it for now. I think things are only going to deteriorate, but for right now, I can. And then, you're the boss, you and Samantha. So if you guys say that we're going to do it, I will be ready and prepared.
All right. Well, and let's talk quickly too about Jimmy's other question about the vaccine availability. So Dr. Pate, as you said, you've heard from people like it's been easy for some, not easy for others, based on this new recommendation that you have to be 65 years old or older or have a pre-existing condition. And I will tell you that at my pharmacy, I was able to get my COVID vaccine. I am not over the age of 65. I was able to fill out a form. My husband went in the next day, filled out a form. They actually came back and gave him, and I think Dr. Pate, it was very similar to the list that you have on your blog post, numerous factors that you could check off, and so he was able to. And then I took my children in and asked for the COVID booster, and they were very good about saying the recommendation is 65 and older, and I was like yes, I understand that, and I said, and they have pre-existing conditions, and they were like okay, and went and gave them their COVID boosters. I only bring this up anecdotally because I think that I knew what to do. I knew where to have the information. I think for a lot of people that is a barrier if you don't have the information or you assume that the recommendation means that you can't get it, because if you don't have a pre-existing condition, they'll still give it to you, but you may have to pay out of pocket, and we're talking potentially in the hundreds of dollars.
Right. And so, from what I'm hearing, most people are still having a relative ease in getting the vaccine. There are exceptions. Some pharmacies have a much smaller list of the qualifying conditions. And so you may want to talk to your friends about which pharmacies you're getting that more expanded list, because with that more expanded list, it's something like 74% of adults will qualify. And in fact, even people that don't think their kids will, a lot of times the kids will still qualify if they're using that expanded list. And like you
Hmm.
said, I put that on my blog for you. So go in, just like you said, Gemma, being prepared and knowing where you fall in those categories can be a big help. Otherwise, if you are having trouble, you could talk to your doctor, get a prescription for it, and then they will give it. And there are some states that, like, for example, if you have some travel planned or something, there are some states that are reducing all the barriers so that basically, if you want it, you can get it. And so you can certainly check if you're doing some traveling. You might just want to get your shot while you're wherever you're going.
Sue writes in and she says, my husband and I are traveling to Egypt and Jordan this fall. He visited the St. Luke's travel folks recently to ensure his immunizations were up to date. And he received a polio booster and an oral typhoid preventative. And Sue writes, I was born in 1956, so I have fond memories of receiving the Salk vaccine on the sugar cube. Is it necessary to get a polio booster? I had no idea we might be vulnerable.
Right. Generally, the answer would be no. The problem is that you said you're going to be traveling to Egypt, and Egypt is on the list of countries with a travel advisory because they've had some polio outbreaks. So when you are traveling internationally, it is a really good idea to look at the travel advisories for the countries that you're going to, because you may not be expecting an issue just like this. So in this case, yes, it is recommended to get that one polio booster. So you and your husband now, even if you travel to another country next year or the following year, you won't have to get another polio booster. What I fear is that eventually, with all the nonsense going on here, like in Florida and all, we may be one of those countries that ends up on the list one day.
So, Dr. Payne, I have a question then. So, for those of us who never got the polio vaccine, um, if we were traveling to a country like Egypt, would it be recommended then that folks in my age category and younger would also need to get a polio shot?
Absolutely, yes. The polio, it depends on where you're going as to how bad it
Mhm.
is, but polio is one of those viruses that spreads um, behind the scenes. In other words, you're not going to know that somebody is sick, that somebody's got polio, they're transmitting it to. You're not going to know. And so, absolutely, polio is a dreadful disease. We cannot predict which individuals that get polio are going to get poliomyelitis, be paralyzed, be disabled. So, yes, you would be definitely encouraged to get. And in the United States, we use the shot form. We don't use that sugar pill form, although I have fond
Mhm.
memories of it as well.
So I only have about 1 minute left with you, Dr. Pate. So if people are going to be, because I just know a lot of people travel, should they be just paying attention to? Is there a government website that folks could be looking at, like where these high cases are, like the travel warnings, things like that, so people know what boosters or vaccines to get if they travel outside of the country?
Yeah, if you are traveling outside the country, you should look at three places. Number one, look for the CDC travel advisories, or like the other listener, you can go to a travel medicine clinic because they can check all that for you. But yes, look at the CDC travel advisories. And then, second, you ought to register with the State Department for whatever country you're traveling to, for reasons you can read on their website. And then third, I wrote a blog maybe just before Christmas of last year that you might want to read, because there are a lot of issues that people don't think about with international travel that you probably should think about. And it's not just vaccines.
All right. Well, as always, Dr. Pate, really appreciate you coming on and talking with us. Remember, if you have a question for Dr. Pate, send us an email, idahomatters@boisestate.edu. And also next week, we will be digging into the MAHA strategy health plan that was just released this morning. So Dr. Pate will join us next week as we dive into those recommendations. So make sure you join us next week as well. You've been listening to Idaho Matters from Boise State Public Radio. I'm Gemma Gaudette.